Right now we are going to measure supination and pronation of the elbow. You're going to have the client, you're going to want the client to hold her arm up, and you're going to want the client to make sure the humerus stays close to the body, so you're going to have her use her other hand to keep that close. You don't want any external or internal rotation of the shoulder. You want the humerus and the forearm to be at a 90-degree angle, and you also want the wrist to stay at a neutral position. You do not want any flexion or extension of the wrist. To help measure, you can have the client hold on to a pen or pencil and make sure this stays up a little bit so it's easier to measure. You're going to use your goniometer, and the stationary arm is going to be perpendicular to the floor, and when you're measuring you want the moving arm to stay parallel to the pin. And your fulcrum is going to be at the third metacarpal phalange joint, which is the third knuckle. So you're going to, supination is palms up and pronation is palms down. So to measure the supination, you're going to have your client put palms up, and again you just want the moving arm to be parallel to the pin. So she's right at 90 degrees, which is normal. And then to have pronation, you're going to have the client move palms down, and she's right at 90 degrees. To measure passive and active range of motion, you are going to have the client supinate as far as they can go, and then you're going to measure, so she's right at about 60 degrees. That would be your active range of motion. To measure passive range of motion, you want to move the distal part of the forearm and make sure you're turning the forearm and not the wrist, and as much as it will allow you to go. And she's at right about 90 for the passive range of motion.